Good morning. This is Dr. Timothy Scott Beck here at Life Point Medical. It is July the 21st of 2025. Wow, this year is flying by us. I want to talk to you guys about a couple things here that I think will be relevant for you. The first one I want to talk about is somewhat of a new service that we're offering here, but it's not really that new. I've been offering this for a while. I just never formalized it a little bit. And that's a la carte labs, meaning that I get a lot of people who come in who want this lab or that lab. And quite frankly, for us to order a lab and have the insurance company pay for it, we usually have to have a visit, some kind of a justification for the lab, and we actually have to code it correctly with the right justification code. Or the insurance companies won't pay for it. That's why when people come and ask for a lab and they're like, why can't you just do the lab? I'm like, no, we've got to do everything that the insurance company wants us to do to process that lab. But if you want to pay cash for your lab, we have a cash service for your labs, and you can order a la carte labs. You don't need a visit. The front desk people and the lady sitting in the lobby understand what's going on. So we have a list of labs that you can purchase for cash. Okay, and if you're like, I want my XYZ tested, and you're like, I'm not going to do an appointment. I just want this lab because I want it because I want it. You're entitled to that. I don't mind that, and that's legit. And there's nothing wrong with you wanting a lab, paying cash for it, and receiving the lab. So we have that set up here, and we have the menu, and we have a brief disclosure. We have to disclose to you that you're paying cash for the lab and that insurance or Medicare will not be paying for it. And we also have to disclose that you should discuss this with the provider, which we're always available to discuss these labs if you get these done. And that can be an appointment to discuss labs, okay? So there's no restriction on making an appointment to discuss the labs, okay? But we don't build in the price, though, of the lab for the discussion. So if you want to order a lab, you're welcome to order and pay for the lab yourself. And then if you want to discuss it with the provider, which we recommend specifically if it's abnormal, then you can make a visit, and that will be charged to your insurance or to you, whatever is appropriate. But I just wanted to make sure you knew that service was here. It's just like shots. You come in, you pay for your money, we give you the treatment or the lab, we draw it, it gets sent to you, it gets stored in your chart. We have access from then on. The only difference is you paid for it because you specifically wanted it. The other thing that I want to talk about is spiders. We have had like 10 spider bites in the last week. It's definitely spider season here in Rabun County, and I've always said there's three things you can count on in Rabun County: snakes, spiders, and rain. And the spiders are out in full force this year. So let's talk about that. First of all, what does a spider bite look like? So typically you'll feel pain where the spider bit you, and usually it'll leave a mark, and it's kind of unique. It's square, it'll be a square mark, maybe about that big, and that reflects a spider bite. It's square or rectangle. It's very strange, but I usually can tell when I see them because they'll be red and kind of raw under that little square that they're on your skin. And then sometimes if it is a poisonous spider, you will get necrosis around that area. So the management for spider bites, if you get one, is usually going to be conservative, like we're watching them, trying to prevent secondary infections. And a lot of times we don't know how big the spider bite's going to be because of the toxin kills the tissue around that area. So it makes it dies off slowly and can make a cavity or a hole there. So mainly it's supportive care and maintenance if we do have a spider bite. Sometimes they turn into a real big issue, and we have to get plastic surgery involved. Rarely does that happen, but sometimes it does. So to prevent spider bites, though, I did a little research. So let's talk about specific ways to reduce spiders. So first of all, it seems like the spiders bites that we're getting are people that live close to certain bodies of water. Okay, so I do think that water is probably an increased risk factor for it. However, Rabun County has got water everywhere, and we're very moist, temperate rainforest, so moisture doesn't seem to be a problem, and we have tons of spiders around our house. So number one, reduce spider habitats by eliminating clutter, trimming vegetation, removing webs and egg sacs from around your house, and reduce the outdoor lighting, which attracts bugs, which spiders eat off of. Seal cracks in your doors and your foundation, and ensure your windows and screens are closed and sealed tightly. All right. Safe handling practices: wear gloves, long sleeves, and pants when working in areas where spiders might be present, like wood piles, garages, and sheds. Shake out the clothing, shoes, and bedding before use, especially if they've been stored. And a lot of people do get spider bit in bed. It's very strange, but that does happen. And then be cautious for reaching into dark, undisturbed areas like storage boxes and wood piles. Move beds away from the wall to prevent spiders from crawling onto them, and avoid storing items under the bed. That's a habitat. And then for insect repellents, use the DEET, D-E-E-T, to help ward off these spiders. And if you encounter a spider, don't crush it, because sometimes that's how people get bit. You want to gently brush it off your skin. And then last but not least, practice good pest control with a professional pest control company here in town on a routine basis to help with spiders. Okay. If you get a spider bite or you think you got one, we definitely want to see you here in the office, and that's why we do same-day appointments. Just be wary of them, and use some of the tips that I gave you here to prevent you from having spider bites. Okay, that's me talking enough today. Thank you so much for listening. We're open and we're ready for business if you need something from us. And I'll talk to you next week. Have a great day.